about what this means in terms of implications. What does it mean for clinical providers? What does it mean for clinical practice? But also, what does it mean for policymakers? I'm also at the very end, if there's time, going to share a little bit about our approach to community engagement and really how beneficial our community partnerships in this study have been. Sorry, I saw something in the chat. I wanted to make sure it was not a question for me. It was not. Okay, first I'd like to introduce our team, some of whom are on this webinar this morning. This study is really a true partnership. It's a partnership across schools within the university, but also with Volunteers of America Mid-States, which is really our key community partner in this project. Here at the University of Louisville, we have myself and Dr. Debbie Davis, who kind of co-lead this work. Dr. Scott Duncan is part of this, really has brought a lot of expertise in thinking about not just impacts on women who are in recovery, but their children. And then Yana Fagan and Maddie Shipley are part of the team doing lots and lots of great data analysis. We've structured this team as really community engaged research. So we also have members of the staff over at Volunteers of America Mid-States who are part of our research team. They're on our IRB. They helped us with study recruitment. They're in particular very helpful in helping us think about what this all means and how we translate this into practice. Charlie Downs, Tiffany Cole Hall, and Stephanie Hoskins are really our key partners over at Volunteers of America, along with Jennifer Hancock, who leads that organization. Sorry, there we go. So let me give a little bit of background really to start. This project is a 2-year research grant that is funded by the Robert Wood Johnson Foundation through their Aligning Systems for Health program. This is a program that's coordinated by the Georgia Health Policy Center. So we are not the only grantee. There are other grantees involved in this as well. And that's actually been a really wonderful part of this. We get to learn from other people that are investigating similar things, perhaps with a different lens, perhaps in a different context. And that sort of learning community has really added a lot to our work, and hopefully we've contributed some to theirs as well. The theory behind this idea of aligning systems, and they mean that really in aligning systems across sectors being healthcare, public health, and social services. The theory is, and I'll just read this quote, if organizations in those 3 sectors work together towards a set of shared priorities based on community goals and needs, they will make sustainable progress toward improving health and well-being in their communities, especially among populations most at risk of inequities. So this really frames our study in many ways. We are leading the SHERO study. This is an acronym, as all good grants have, that stands for Strengthening Health Equity and Recovery Outcomes. We do have a much longer grant title officially. You can see that there on the screen, a study of Freedom Health's collaborative approach to cross-sector alignment in Kentucky to improve outcomes for pregnant and parenting women in recovery. We thought that didn't roll off the tongue quite so well, and so we wanted a catchier name for this that our community partners could recognize. And we also thought that SHERO really honored the women who are in recovery and the work that they're doing to grow, support, and strengthen their own families. So we're really proud to have this name, but also for it to really reflect our mission in this work and the goals. Let me talk a little bit about Freedom House itself. Freedom House is an evidence-based residential treatment program operated by Volunteers of America Mid-States. Freedom House serves pregnant and parenting women in recovery, focusing on both maternal outcomes and infant outcomes, such as substance exposure in the prenatal period and or diagnosis of things like neonatal abstinence syndrome or neonatal opioid withdrawal syndrome at birth. So those infant outcomes that are associated with maternal substance use are really important in this, and largely one of the reasons that I'm sitting in front of you all today. Freedom House started it here in Louisville many years ago, and in 2020 expanded into Clay County in Eastern Kentucky. So our study really investigates cross-sector alignment in systems of care that both include and surround those Freedom House programs here in Louisville, and one in Clay County, which is where Manchester is in Eastern Kentucky. The aims of this study are threefold. Our first aim is really a measurement aim. It's mostly what I'm going to share with you today. It focuses on actually looking at and quantifying cross-sector alignment in those two communities. We also have a goal to assess implementation variations in each community. Our primary lens here is kind of the rural-urban differences, but we also know that other things matter in the context of implementation. There's external environments that sometimes make things easier, sometimes make things harder, and we do want to understand those as well. Finally, we are collaborating with Volunteers of America on our third aim which is really exploratory in many ways, but looking at where we can measure some outcomes data and starting to think about what outcomes might be influenced or associated with the alignment of the system in which women and families are receiving services. As I mentioned earlier, our study does really prioritize community engagement, and if we have time at the end, I am going to talk a little more about that. So let's talk first about the theoretical framework or the conceptual framework that's guiding our study. The Georgia Health Policy Center, which is the program office for this grant program, has developed this framework for aligning sectors. And it was developed with extensive input from experts and from other grantees. What the framework really posits is that organizations in the three sectors, organizations in public health, organizations in healthcare, organizations in social services, can align in certain ways. And if that alignment is present and strong, that those organizations and that system is more likely to promote changes in mindsets, changes in practice, changes in policy, and ultimately improve health and equity. When we talk about alignment here, we're talking about alignment around 4 different constructs. Those are the cogs that you see in this diagram: shared purpose, data, governance, and financing. The framework also incorporates context into this environment, specifically the thinking about the influence of community voice, the influence of equity, of power dynamics that exist in a community, of trust relationships that exist in a community, as important factors that may influence or facilitate alignment. Our study really focuses on measuring alignment within each of those 4 constructs: purpose, data, governance, and financing. But we do also, as I mentioned, look at that implementation context and explore associations with outcomes, which is sort of in this framework what you see over towards the right in the gray circle area. Okay, so why are we looking at systems of care around Freedom House, and why are we really studying this at all? Well, you all know that the opioid epidemic hit Kentucky communities and continues to hit Kentucky communities very hard. That's true for many communities across the country. So we feel like there's things to learn from this outside of our own state. We know that substance abuse doesn't just affect individuals. Substance use affects individuals, their families, and it affects communities. And there are health and social effects of substance use that matter. We have risk of overdose. There's risk of prenatal exposure and longer-term developmental, potentially longer-term developmental issues for infants who are affected. We know that substance use can disrupt parenting. and family dynamics, and their child welfare system impacts. Those are resource intensive outcomes that we care about. We also care, of course, that families remain strong and together. So this is really important because it impacts not just your patients, not just individual families, but also communities. What we also know, of course, is that outcomes associated with substance use are also moderated by other social factors. So things like housing, things like financial stability, safety, and nutrition all influence the outcomes we might think are more direct outcomes of substance use and substance use treatment. So the punchline here really is that the traditional healthcare delivery systems can't solve all these problems. Other local organizations outside of healthcare may help families meet their public health and their social needs. And if these systems align, or if they're strongly connected in some way, we may improve outcomes. So today I'm going to focus some on what we've learned about these systems themselves and about alignment within those systems. So as we started this work, we didn't really know who was engaged in this system. So we had an early part of our first aim where we really just worked to kind of identify who was delivering care or providing services and supports within the system. So we talked with staff over at Volunteers of America and Freedom House about who their key partners were in their programs. And we talked to and interviewed current Freedom House clients and recent Freedom House graduates and asked them about who they got services from before going into Freedom House, while they were in Freedom House, when they left and graduated from Freedom House. We also asked them about where they tried to get services, but perhaps couldn't for some reason. So that's really how we constructed and identified who organizationally sits in these systems of care. And what you can see here is the composition of each of those systems. So again, we're comparing in this study Jefferson County to Clay County. And Jefferson County, throughout all of this presentation, is going to be on the left-hand side of the screen. Clay County, I'll present data on the right-hand side of the screen. What I want to point out here, and what you may have already noticed, is that there are slightly more healthcare organizations identified within this system here in Jefferson County. And that may seem kind of obvious because it's a larger community, there are more providers of care. So that's kind of on the urban community side. We do see more public health organizations engaged in the system surrounding Freedom House in the rural community. So what does this mean? Specifically the larger number of public health organizations. We think that's potentially related to Clay County being more rural and less resourced, being more dependent on public sector organizations. We do see that both systems really rely heavily on social service organizations, and those organizations include all different types of things: housing, other types of legal services, educational services, so things that are very outside of the realm of traditional healthcare or public health. I am going to check the chat really quickly and just make sure that was not for me. It's not. I do want to be responsive to any questions you have. So I'll have time at the end, of course, but I also, if there's something that I haven't clarified, please feel free to ask a question in between. Let's talk a little bit about methods. So I mentioned just a minute ago that we specified the boundaries of these networks or systems based on interviews with Freedom House clients, staff, and Freedom House graduates. This study was impacted by COVID. We wrote this grant in 2019. It was funded in April of 2020. So we launched this in a time of lots of uncertainty. And that kind of shifted a lot of not just what we asked in the study, but kind of our timeline. So we had always planned to do data collection via telephone, really it's computer assisted telephone interviews. And those took much longer to do than we anticipated. Maybe some of that was just us not understanding how long it would take when we planned this, but also I think some of that was impacted by COVID. So we did collect both quantitative and qualitative data using computer-assisted telephone surveys. The survey instrument itself included questions related to overall interactions between organizations, whether or not those organizations shared a mission, which is not really part of the theoretical framework here, but is something that has revealed some really interesting things that I'm going to share with you all today. We ask questions about shared purpose. We ask questions about data sharing in the community, about financing mechanisms in the community, and about governance. We also asked a number of open-ended contextual questions, kind of getting at some of that aim to what's the context of the environment that may make alignment or collaboration better or worse. The open-ended questions, we included one around COVID, how has this changed your care delivery, service delivery locally? We asked questions about community data sharing systems, whether or not there were things in the community that facilitated data sharing. And then we asked about community coalitions. Were there any community-wide coalitions or governing bodies that did that sort of led prioritization of community issues and or decision-making and prioritization of those issues? We used social network analysis for most of this quantitative work that I'm going to share with you today. That analysis is conducted using a software called UCINet. It's a software that was produced by some colleagues over at the University of Kentucky. A complementary software program to that helps us visualize systems of care, and that software is called NetDraw. Today, I'm primarily going to focus on sharing results from AIM-1. That's our big network study. That's our primary focus in this, definitely our most resource-intensive part of this work. The key measures for that network study are listed down towards the bottom of this slide, right above that table. Today, I'm going to focus most of what I share around the measure of density. And this measure really gets at existing relationships or ties between organizations. So within a system, if there's alignment or partnership among all organizations in the system, density is going to be 100%. If no partnerships existed, density would be 0%. So density itself really tells us about the number of ties or relationships that exist as a proportion of all possible ties that could exist. I'll mention here that I want to mention our response rate. So we had a total of 28 organizations in the Clay County system and 25 organizations in the Jefferson County system. We aspired, possibly very naively, to getting about an 80% response rate and really could not get there. It was a difficult time to be collecting data. There was a lot of pressure on community-based organizations for lots of reasons, some of them economic, some of them around human resources. So we really weren't able to get as many responses as we had hoped. But I can tell you, and my colleagues on the study who are here, I can see them smiling in my head. Our response rates for both communities were just over 55%. And so it's lower where we want to be, but way better than where we started. There was a point in time in the study where we had done a lot of outreach ourselves, and we were at like 15 or 20% in terms of response. And it really wasn't until we very actively engaged our team members over at Volunteers of America to help us with outreach and recruitment that these numbers started going up. part of the reason we think that is because here we are, these, unknown researchers from this university, and no one knows if we're legit. No one knows who we are, but Volunteers of America has those local relationships and was really, really helpful. I think this is one really important learning or lesson really for us, is that value of community engaged research. Having community members actually on your study team was hugely helpful for us in recruitment. Want to spend just a moment before I share some results talking about those constructs. So as you recall from the framework for aligning systems, there's 4 areas in which that framework looks at alignment. It looks at alignment around purpose, data sharing, financing, and governance. And so we had to operationalize what that meant, right? We couldn't go ask a question that was like, do you and this other organization share a purpose? Because what does that really mean? And so we operationalize these constructs with a set of questions within each of them, looking at, for purpose, for example, similarities in organizations' missions, whether or not organizations focused on impacting similar outcomes, whether or not they partnered formally around service delivery, if they made referrals to each other, for example. We were especially interested in the extent to which organizations partnered around advocacy. That could be policy advocacy or advocacy around strengthening other local systems. Within data sharing, we looked for whether or not organizations had formal data sharing agreements, if they partnered around measurement of those outcomes that they may both be seeking to impact, and if they collaborated around changing data systems or policies that influenced whether or not data sharing was made easier or harder. In terms of financing, we looked at if organizations worked together on grants or contract funding, if they paid each other for services that may be provided to clients that both organizations see. And again, this sort of advocacy piece, did they collaborate to change financing systems or policies? In terms of governance, this is one that we struggled with operationalizing early on, and our community advisory board was very helpful in us thinking about what shared governance might really look like. We looked at whether or not there was a presence of a governing body across the organizations at kind of at the community level, whether or not individuals in an organization served on governing bodies at like boards at other organizations, and what those roles really were. Okay, so let me start sharing actually some information. So one of our first steps in this was to really kind of just understand these two communities outside of the system. I've said it before, but these data really demonstrate it. These are two very, very, very different counties in our state. Jefferson County, obviously the biggest urban center here in the state, Clay County being much, much more rural with not even, these are 2019 data, not even 20,000 people in the whole county. Despite it being somewhat larger geographically, a bigger, at least in terms of square miles, a larger geographic county. Median household income in each county is also quite different, substantially higher here in Jefferson County compared to Clay County. And we have very different demographics as well. Clay County is almost 95% white, very different here with about 71% white in Jefferson County, but a much larger Black population. When we look at poverty, insofar as that impacts access to care and family sort of supports, poverty, the percent of the population in poverty in Clay County is over 30%, compared to 14% here in Louisville. As I mentioned, they're geographically different too. It takes longer to get places in Clay County. Most people have to drive at least 30 minutes to get to work. It's about 10 minutes less here in Jefferson County, possibly due to geography, but we think this is also a good measure of and analogous potentially to how far people have to drive, if they can drive, to get services. Okay, so let's talk about some data. So first, I'm going to share some data about just basic collaboration across organizations. Do they work together in any way, formal or informal? That was kind of the first question we asked all the respondents here. Do you, organization A, work with organization B around serving pregnant and parenting women in recovery? And what we really see here, remember density, the higher the number, the more relationships that exist. So what we really see here is we don't see a huge difference across these two communities. Slightly higher density, slightly higher proportion of relationships that exist in rural Clay County, but really not that much different when we talk about overall collaboration. I mentioned that software program NetDraw that helps us visualize systems. Here's our first example of that. These network maps show you the visual structure of these systems, which highlight that some organizations may be more centralized within the network. And that matters because organizations that are central to a system can play a key role in disseminating information and disseminating innovation or ideas. Denser networks, so networks that have more lines in between organizations, more ties that are present, may have actually more pathways for sharing, for the exchange of information and for resource flow across a system or network. So these help us think about not just where organizations sit in a network, but what strategic role they can play in delivering care within that network or system. When we look at ties across sectors, we do start to see some differences in Jefferson County versus Clay County. We see that alignment tends to be stronger cross-sector wise between public health and social services in Jefferson County. We don't see as much cross-sector alignment with healthcare and these other sectors. I think an important implication of this work. In Clay County, we tend to see stronger cross-sector ties between healthcare and public health. Okay, so in our network interviews, in those conversations we had with representatives of each organization, we asked the respondent to describe the mission of their organization. And we, Maddie Shipley, who is the graduate research assistant on this project, and I did all of these interviews. And we did not record them. We just typed furiously to make sure that we documented everything that they told us. So when a respondent talked to us about their mission statement, we took very detailed, pretty much verbatim notes there about what their mission statement was. And Maddie has been really thinking about how to creatively look at some of that and created these word clouds for us, which I think really demonstrates some really key differences in organizational missions in each community. What you see here in these word clouds are really where there's commonalities in the verbiage that we heard. So bigger words came up more often, smaller words came up less frequently in those responses. You see on the left in Jefferson County, which as a reminder had more organizations in the healthcare sector, we see more language related to the delivery of care. Provide comes up a lot, outcomes come up a lot, serve, care. In Clay County over on your right, which is again our rural community, we see more reference to faith-based services and to community orientation in those mission statements. And I'm going to talk a little bit more about what we think this might mean on the next slide. So if we look at shared mission quantitatively, so what I just presented on the prior slide is really what people told us their mission was. But then we also asked them explicitly, does your organization share a mission? Not the language of the mission, but do you seek to impact the same things? Do you have a similar or shared mission with other organizations in this network? We see much stronger alignment in rural Clay County. So if you look just at the density measure, respondents really reported shared mission much more often in Clay County. We see about 60% density in Clay County, kind of a darker network there compared to Jefferson County, where the density is only 36%. So really in Jefferson County, organizations here tended to have more individualized mission statements. And we've thought a lot and talked to our community partners a lot about what this means. So one hypothesis we have, and that we're hoping to investigate more directly in our last round of data collection, is that here in Jefferson County and Louisville Metro, there's more duplication of services. More organizations here are delivering similar types of services. So the organizational missions become more specialized, more distinct, as a way to differentiate that organization in the local marketplace. It's almost as if there's more competition for clients, for resources. And so there's we think really market differentiation that's happening here that may prevent alignment because of those other underlying, possibly even economic forces that are playing in. We also know that in Clay County, there's sort of a local culture of collaboration. There's kind of one of everything, where there's not really redundancy, if you will, in service delivery. So thinking about density more specifically within those constructs we've talked about, not just purpose, but financing, governance, and data sharing. What we see in urban Jefferson County is that we observe really stronger alignment around relationships that require technical infrastructure or resource investment, such as data sharing or shared finance. Data sharing is, of course, I think probably everybody that's listening to me right now, data sharing is challenging legally. Data sharing across organizations, in particular if there's health or education data related, but it's also challenging technologically, especially for community-based organizations. It relies on systems that facilitate data sharing sometimes. What we found out through this work, and what you all may be aware of, is that in Jefferson County, there's a citywide nonprofit who has invested a lot of money in establishing a platform for data sharing that makes data sharing easier to do here. And so we think that's one of the reasons, one of the contextual factors really that sort of explains why we see shared data relationships stronger here in Jefferson County compared to rural Clay County, where platforms like that do not exist. Survey participants in Louisville, when we talked to them about data sharing, really mentioned very specific and localized places. So they mentioned the Unite Us platform, the homeless management information system as places they go to enter and share data across organizations. In contrast, data sharing in Clay County seems to be more informal. They call each other versus entering data into some formalized systems. Or they do rely on some state data systems and infrastructure, but that seems to be more specific to like grant reporting or program reporting. Relatedly, rural Clay County had stronger alignment around governance and shared purpose. So as we've talked about before, in the rural community in Clay County, there aren't a lot of service providers of any kind, really, much less two providers doing the same thing. So they don't overlap in services as much, and they also don't have as many resources. So when we think about shared governance and decision-making, everybody kind of seems to be at the table. It's a community where when you run to the store, you're also seeing people you collaborate with in your professional work. Participants in Clay County told us more about service or population specific community coalitions as compared to Jefferson County, where coalitions here seem to be really more focused on a specific topic area and not really sort of overall community needs, which is what we observe in Clay County. Clay County is seems to be kind of more aligned around relationships and those constructs that don't necessarily require money to do, but do require time and personal relationships. We are still analyzing these data and really hope by the time the grant ends at the end of the year that we have some evidence related to whether or not Freedom House clients are better off. As I said, we are measuring outcomes, whether or not communities are better off. What is the system of care that we're framing around women and families? What does that potentially tell us about how they serve other groups? You know, a lot of these organizations serve lots of different types of clients and individuals. And so we really want to think about what we learn here, how we learn here really translates into other settings and other communities and other populations. What does this mean for you all as providers, as pediatric providers? You serve children and families in the context of larger service delivery organizations, larger service delivery systems. Your patients very likely need and get services from other organizations in the community. How you or your organization connect to those other places and how they connect to each other can impact outcomes for the children that you serve, for those children's families, and for the community. So stronger alignment between organizations, right? This is the whole theoretical foundation here. Stronger alignment between organizations may facilitate better service delivery across sector. And it may improve individual, family, and community well-being. This study really, I think, has a lot of applications to both service delivery, to the organization of care within these systems, and to kind of the policy conversation. Freedom House is such a wonderful partner and really wants to and has already taken these findings and is thinking about those as they expand Freedom House into other communities in Kentucky. So they use these findings to strategize again around how to best serve clients and graduates. One thing I have thought about a lot with some of our findings related to mission statements is that as clients are referred to Freedom House, you know, now that Freedom House exists in more than one community, if a client, you know, shares that they may be they may really need faith-based or religious-based services, that's something they value. There are communities where that exists, and there's communities where we don't see that as much, at least not in these formal systems. So it's a way to be strategic about where a client can be successful in recovery as well, given what their other non-healthcare needs really are, and what their other non-healthcare related wants really are. Understanding where alignment exists and how it's strengthened can help community-based organizations and healthcare delivery organizations in better align and maximize outcomes for those that they serve. Policymakers, I'm a policy person, so I always have to think about this, can use these findings really to inform decision-making around how they can better resource communities and how they can better resource delivery organizations so that they strengthen existing alignment, incentivize meaningful collaboration, and improve health outcomes. I have a little bit of time, and then I'll stop for questions. I do want to talk a little bit about our community engagement approach, because I think it really matters to our success in actually doing this research. So we took what I would characterize as a very active approach to community engagement from the day we decided to write this grant. Volunteers of America is really a community research partner. We included in our budget money to support and hire staff at Volunteers of America who are part of our research team. That includes a community facilitator who is a graduate of Freedom House. And so this is somebody who has lived experience that none of us on the study team have. And she has brought incredible insight to us, not just in sort of what it was like to be in Freedom House and what her own experience was, but also helping us think about meaningful outcomes for families and for children. They've been just really great partners. I mentioned earlier the role they've played in recruitment, which wasn't, I don't know that we upfront defined their role as strongly in recruitment as they ended up playing, but it really helped us a ton. They also capture some outcome data that they are providing to us to look at in terms of family outcomes. We established through this project a community advisory board made up of representatives of organizations and community partners in both communities. The community advisory board has been hugely helpful in both our study design but also really the interpretation of these results. In addition, they help us find opportunities to share these findings with other people, both at the local and state level. This has not been easy, though. It's been great. I don't think we would be successful without the community partners that we have established and without those relationships that we have built, but there have been challenges. I'll talk first about facilitators. One of the kind of key things here is that Volunteers of America and leadership within that organization was part of our grant writing. We didn't write a research grant and then go to them and say, hey, let us do this. Remember those trust relationships we talked about as influencing alignment? Those also influence partnership and research partnerships. And I think that was really critical. The team over at Volunteers of America is so committed to this. They really want to learn. They want to use it to improve. They also like research and outcomes, which is, a big benefit for people like me. So that's been a really great facilitator of our partnership. One thing we heard early on, as we were talking to some graduates and clients of Freedom House, lots of moms telling us because we provided an incentive for those interviews and wanted to honor their time that they were giving us. And several would say, I don't really need that. I really just want to help other moms. I really want to pay it forward. I've benefited from this. I want to make it better for other moms and other families. In terms of challenges, time on any project is a challenge. It became even more of a challenge in the COVID era because everything took longer than we thought because so many people and so many organizations we're sort of trying to figure out how to operate in the context of a pandemic. We did have some early hiring and turnover, particularly in that community facilitator role. It really was a lesson for us that fit matters, and the space in which someone with lived experience is in their life, if they're ready for more of an advocacy type role, that really matters in terms of who will thrive in a position like we created with this grant. Certainly in that community facilitator role, we learned about balancing that real value of lived experience, but also with skill development. So several of we've sort of had to work through technology, and not everyone uses Zoom as much as all of us on this call. So there were sort of some technical skill development, IRB, getting folks on our IRB who've never been exposed to any of the language we use around human subjects research and sort of those ethical protections. Took some time, but it was also totally worth it. We also launched this study in 2020, and the world was changing in a lot of different ways at that point. There's people on this team that I have never met in person. We've had great technology to facilitate our virtual meetings, but it is not a perfect substitute. We have not been able to visit Clay County. We haven't been able to meet our community advisory boards. And obviously our community advisory board members are also community members, and they have lots of things going on in their own personal and professional lives that they, have to prioritize sometimes. With the racial justice movements that really have grown really since 2020, but have been something we've been thinking about for some time, is this idea of inequities. And we had a lot of early conversations about how we measure inequities and how we look at that, even with data that are coming from Volunteers of America. And so because I don't think we had adequately thought about what that means and what inequities may exist and persist, we spent a lot of time with our community advisory board and with some staff members over at Volunteers of America, really thinking about how we want to look at inequities in this. And not, the major lens here in our study has been this urban-rural difference, but we know that even within Jefferson County and even within Freedom House itself, there can be and very likely are disparities that we will observe. And we definitely want to frame recommendations in the context of that environment. So we are continuing data collection. As I mentioned, we have one last round of data collection from these organizations, really looking at if things have changed over the last year. And then we are working hard to disseminate this. We want our study to mean something to people, and so we're sharing it with other researchers, with people like you. We will be writing some manuscripts and doing a book chapter, but also doing local presentations, so that members of both communities and organizations in both know what we're doing and can take it to improve their own work and health in their community. With that, I am going to pause, but we'll add an acknowledgement to our team, the whole team, but especially to Maddie Shipley, who was really critical in our success around data collection and analysis. Yana Fagan, who had never done network analysis, and before, neither had Maddie. They both got some training over the summers and have done a wonderful job analyzing these data. Also want to thank everyone at Volunteers of America and Freedom House, but especially Charlie Downs, who's our community facilitator, a wonderful person and really, really key to our study recruitment. So with that, I am going to stop, and I am happy to answer any questions or talk more about this if you want me to. And I have not looked at the chat.
Liza, it's Scott Duncan. Let me throw in one thing, because you understated our dissemination a little bit with upcoming event.
Okay.
And this is a shameless plug for Volunteers of America and the study both. Volunteers of America and Freedom House as a model has caught national attention. And we have hosted as part of Volunteers of America, Senator McConnell and Governor Beshear on a couple of occasions. And February 24th, we are hosting not only Senator McConnell, and Liza will be part of a panel discussing Freedom House and the study, but also included in that is Dr. Rahul Gupta, who is the director of what is the official title? He was previously the senior vice president of March of Dimes, but he's currently the director and lead at the Office of National Drug Control Policy. So that's a very exciting opportunity, and I hope people recognize that this has caught national attention at a state and a federal level.
Thanks for bringing that up, Dr. Duncan. In my career, I really got into this to not just do research. It's fun. I like data analysis, but really I need it. I'm fulfilled when it actually helps people. So to get the opportunity to present to policymakers is at any level, and that policymakers at the local level, even that's hugely important as well. And I think this is really relevant to some local policy, but that opportunity to share something that with people that have resources and power to take it somewhere is really super cool. Something I've been looking forward to my whole career. Tara, I see your question in here about whether or not we have information on the family structure. No, not really. Definitely we don't have a ton of great individual level data. We are Freedom House and Volunteers of America are providing us individual level data to measure outcomes, and we, as you can imagine, went to them with an initial list of a ton of things we wanted to capture, and they were like, "Oh my goodness, our EMR doesn't do that." So if family structure was one of those things, that is not documented, at least not in a good field in the electronic medical record, but we are trying to document, and Freedom House and Volunteers of America made some changes so that we could capture more context about family structure and sort of other family level characteristics in that individual level data. But it's not great. This is always the challenge of, relying on systems. They almost never get to tell you everything you want to know. I'm happy to answer any other questions. If there aren't any, I do want to just thank you all. I know this is probably a very different type of presentation than what you are used to, but I think the role you all play as providers is so critical in sort of frontline service delivery, identifying needs for families and for children. And also it's, an opportunity for you all to think about what the system of care that surrounds those families outside of your delivery system might look like and might mean in terms of their outcomes. Well, thank you, everyone. Thank you, Dr. Davis, for the note in the chat. I'll sign off if there aren't any other questions.